Hello everyone, I'm Dr. Babu, Senior Lecturer, Department of Oral Medicine and Radiology. Today we will be looking at normal anatomical landmarks in panoramic radiographs. Learning objectives include understanding what normal anatomical landmarks are and identifying various radiopaque and radiolucent landmarks on a panoramic radiograph. Contents of this presentation will include a brief introduction followed by some terms which are commonly used throughout the presentation, and then bony landmarks of maxilla and its supporting structures, bony landmarks in mandible and supporting structures, few air spaces and soft tissue shadows, and followed by conclusion. Panoramic imaging is also called as phantomography. It is a technique for producing a single tomographic image of facial structures that includes both maxillary and mandibular dental arches and supporting structures. Panorama, by the word itself, it means unobstructed view. So, it demonstrates the whole of both jaws, maxilla as well as mandible, on a single film. So, it is advantageous in cases where we need to assess a larger lesion where it is not captured completely by an intraoral periapical radiograph. And secondly, in cases where the patient requires multiple radiographs, panoramic imaging can be done. So, now we will understand how a panoramic image is formed. We all know maxillofacial skeleton is a three-dimensional structure, a curved structure. So, here what happens is the curved jaw is unfolded onto a flat plane, as you can see in this second image. The structures are flattened and spread out. The skull is split vertically down in the mid-sagittal plane and each half is folded outwards. So, the central portion is formed by the nose, nasal cavity and the maxillary and mandibular anterior teeth. As the jaws are folded outwards, adjacent to the central portion, we have on the right and left sides maxillary and mandibular teeth, posterior teeth, followed by the ramus of the mandible and the condyles. And the extreme ends, as you can see here, we have the cervical vertebra on either sides and the styloid process on the extreme right and left borders. So, what are anatomical landmarks? These are any anatomic feature, a fold, it can be a prominence, bony ridge, a duct, a vessel, a foramen, which is consistently present in a tissue and that serves as a specific indicator for a structure or position. It is easily recognizable and it is used as reference points. Now, why do we need to know the normal anatomical landmarks? Because whenever we are interpreting a panoramic radiograph, it is important for us to first identify the normal anatomical landmarks. Because panoramic radiograph is a radiograph where we see the maxillofacial skeleton, and along with that there are a lot of superimposition of other structures. So, as a result, it becomes challenging for interpreting a panoramic radiograph. So, we need to first understand what are the anatomical landmarks that are present on a radiograph to understand what are the pathologies present in that particular radiograph. However, we always need to remember that not all the anatomical landmarks or the structures necessarily appear on the panoramic radiograph. There may be variation between individuals and also anatomic features can change with time. The absence of an anatomical landmark may be an important finding on an image. So, basically on a radiograph you view objects as either radio-opaque objects or radiolucent objects. So, we will be frequently using these terms radio-opacity and radiolucency throughout the presentation. So, we need to know what radio-opaque mean. Radio-opaque objects are those which obstructs the passage of X-ray. So, they represent as areas appearing light or white on an exposed film, and radiolucent are those which allows the penetration of X-rays through them. So, these structures appear black or near black on the image. Now, we will see the bony landmarks in the maxilla and its supporting structures. Pterygomaxillary fissure. It is a triangular shaped area which is seen as a lateral opening of the pterygopalatine fossa. This is a narrow cleft which separates the lateral pterygoid plate, that is this, from the maxilla. On a panoramic radiograph, it appears as a bilateral teardrop shaped radiolucency. Maxillary tuberosity. It is a rounded eminence that is seen at the postero-inferior surface of the maxilla distal to the third molar, as represented by this. On a panoramic radiograph, it appears as a radio-opaque bulge on the area distal to the third molar. Maxillary sinus. It is a large air-filled cavity in the body of maxilla. It is pyramidal in shape with its base directed medially towards the lateral wall of nose, and apex is directed laterally to the zygomatic process of maxilla. Roof of the maxillary sinus is formed by the floor of the orbit, and floor of the maxillary sinus is formed by the alveolar process of the maxilla. On the floor of maxillary sinus, we can see tiny conical elevations which are noted, which represents the roots of maxillary posterior teeth. On a panoramic radiograph, maxillary sinus appears as paired radiolucencies located above the apices of maxillary molars. Here, as you can see, it is marked, and the floor of maxillary sinus, since it is formed by dense cortical plate, it appears as a thin radio-opaque line just above the roots of maxillary molars. Next, we will be looking at the floor of the orbit and infraorbital canal. Orbit is a pyramidal bony cavity that is situated on the each side of the roof of the nose, which houses the eyeball. On a panoramic radiograph, orbit is seen as round radiolucent areas on bilateral in appearance, located just superior to the maxillary sinus. Because of its superior position on a panoramic radiograph, we will be able to appreciate only the floor of the orbit. The two blue arrows represent the floor of the orbit, which is seen just above the maxillary sinus. Nasal septum. It is a median osseocartilaginous partition which divides the nasal cavity into right and left halves. On a panoramic radiograph, it appears as a vertical radio-opaque partition that divides the nasal cavity onto right and left halves. This represents the nasal septum. Hard palate. Hard palate is a bony partition between the nasal cavity and the oral cavity. Hard palate is formed by two bones. The anterior 2/3 are formed by the palatine process of the maxilla, and the posterior 1/3 is formed by the horizontal plates of palatine bone. On a panoramic radiograph, hard palate appears as a horizontal radio opaque band which extends from the third molar region onto the other side third molar above the roots of all the maxillary teeth. Zygomatic process and zygomatic arch. The zygomatic arch, or otherwise called cheekbone, is formed by the zygomatic process of the temporal bone, that is this, and the temporal process of the zygomatic bone, which are being united by an oblique suture which is called the zygomatico-temporal suture. This is a zygomatico-temporal suture. On a panoramic radiograph, it appears as a J-shaped or a U-shaped radiopacity. So, on the skull, this part is the zygoma. So, here it appears as a J-shaped radiopacity represented by C here, and the arch is the posterior extension. As you can see, this is the arch, D representing the arch, and here there is the zygomatico-temporal suture, but that suture is not very clear on this panoramic radiograph. So, till now we have seen a few structures which are located on the maxilla. Now we will see some of the structures, supporting structures around the maxilla, which is seen in the similar region. One is articular eminence. Articular eminence is a rounded projection of the temporal bone just located anterior to the glenoid fossa. So, 2 represents the articular eminence. On a radiograph, this articular eminence represented by 1. It appears as a rounded radio opaque projection which is located anterior to the glenoid fossa. So, glenoid fossa is otherwise called the mandibular fossa. It is where the mandibular condyle rests. It is a concave depressed area on the temporal bone. On a panoramic radiograph, it appears as a concave radiopacity which is seen just superior to the mandibular condyle, represented by 2 here. Then we have the styloid process. So, styloid process is a thin, long, slender process projecting downwards and forwards. On a panoramic radiograph, it appears as a radio opaque spine extending and superimposing onto the posterior border of the ramus of the mandible. On a panoramic radiograph, we can also appreciate the anterior arch of C1 and body of C2. This is the anterior arch of C1 and the body of C2, the dens of C2. So, this is represented as a triangular shaped radiopacity projecting from the vertebrae onto the condylar area, the posterior border of the ramus of the mandible. Another structure which we can appreciate is the hyoid bone. Hyoid bone is a single U-shaped or a horseshoe shaped bone which is present in the midline. On a panoramic radiograph, it appears bilateral U-shaped radiopacity just below or at the level of lower border of the mandible, represented by 6 here. Another structure is external auditory meatus. It is represented as a radiolucent round area just above the mandibular condyle. External auditory meatus, which is noted posterior to the mandibular condyle. On a panoramic radiograph, we will see it on the borders, lateral borders of the radiograph. We have now seen bony landmarks in the maxilla and its supporting structures. The next few slides we will be looking at the bony landmarks in mandible and its supporting structures. Condylar process and coronoid process. Condyles are rounded projections of bone extending from the posterior superior border of the ramus. Condyles are generally positioned slightly antero-inferiorly. It is because when we are positioning a patient for panoramic radiograph, patient is asked to bite on a biting fork, which results in slight anterior and inferior movement of the condyle. On a panoramic radiograph, condyles appear as round radio-opaque projections extending from the posterior part of the ramus of the mandible, as you can see as the circled area here. This is the condylar process. Coronoid process, it is a bony projection which is seen from the anterior part of the ramus of the mandible. On a panoramic radiograph, it appears as a triangular radio opacity just anterior to the condyle. In this, we can also appreciate the ramus of the mandible, which is a quadrilateral shaped part of the mandible, from where there are two bony processes noted. One is the condyle from the posterior part of the ramus and the coronoid from the anterior border of the ramus. Next, we will be looking at sigmoid notch. Sigmoid notch or mandibular notch lies adjacent to the condyle, between the condyle and the coronoid process. It is a U-shaped concavity. So, on a panoramic radiograph, it appears as a U-shaped radiolucency as represented by this red arrow. Mandibular foramen, mandibular canal and mental foramen. So, the mandibular nerve enters into the mandible through the mandibular foramen, which is located at the central portion of the ramus, from where it descends downwards and anteriors through the body of mandible. So, it descends down through the inferior alveolar nerve canal or the mandibular canal, and it terminates at the mental foramen, where the inferior alveolar nerve, it comes out as mental nerves and vessels. So, this mental foramen is located at the periapical region of mandibular premolars. On a panoramic radiograph, mandibular foramen appears as a small round or oval radiolucency, which is located at the mid portion of the ramus of the mandible, followed by a radiolucent band which we can appreciate traversing downwards and forwards, representing the mandibular canal. And the mandibular canal has two radio-opaque lines surrounding it, representing the cortical walls, terminating as mental foramen, as we can see here at the apices of mandibular premolars. External and internal oblique ridge. These are prominent ridges that run downwards and forwards. External oblique ridge is seen on the external surface of the mandible, and internal oblique ridge is noted in the internal surface of the mandible. On a panoramic radiograph, it appears as a dense band that extends from the anterior border of the ramus downwards and forwards towards the mandibular molars. This is the external and the internal oblique ridge. Many a times on a panoramic radiograph, we may not be able to distinguish and see external and internal oblique ridge separately. They will be superimposing onto each other. Mental ridge and mental fossa. Mental ridge is a dense elevation of bone which is located in the anterior part of the mandible, which is like an inverted V extending from the symphysis downwards and backwards towards the premolar region. Because it is a bony prominence, it appears as a thin dense radio opacity in the central portion of the mandible. As you can see here, this is the mental ridge which we will be able to appreciate here, and just above the mental ridge there is a small depression which is called the mental fossa, which is represented as E here, appears as radiolucencies beneath the roots of mandibular anterior teeth. Another landmark is genial tubercle and lingual foramen. These landmarks are seen on the inner surface of the anterior portion of the mandible. So, genial tubercle is a small bony projection which is seen in the midline, which serves as a attachment for genioglossus and geniohyoid muscle. Because these are bony projections, they appear radio opaque, represented by 10 number. Here, and just adjacent to that you can see lingual foramen, which appears as a round radiolucency. Submandibular gland fossa, it is noted below the mylohyoid line, where the mandible is slightly hollowed out to lodge submandibular gland. So, it appears as a radiolucency beneath the roots of mandibular molars, as you can see here, represented by this red arrow. We have now seen the few landmarks which are seen in the maxilla, mandible and its supporting structures. Now we will be looking at few air spaces and soft tissue shadows which superimpose onto the panoramic radiograph. Tongue shadow is seen as a radio opaque area superimposing the maxillary posterior teeth. This part represents the tongue shadow. Soft palate and uvula also cast shadow on the panoramic radiograph, which is represented as a diagonal shaped radio opacity just posteriorly and inferiorly from the maxillary tuberosity. So, this part represents the soft palate and the uvula shadow together. Pinna of the ear also casts a shadow on the panoramic radiograph. As you can see, it is seen along the posterior border of the ramus of the mandible. There are few air spaces which are seen superimposing the panoramic radiograph. Firstly, the palatoglossal air space, which is the space between the tongue and the palate, it is seen just above the tongue shadow. On a panoramic radiograph, it is seen as a horizontal radiolucent band located above the apices of the maxillary molar teeth. Nasopharyngeal air space is a portion of pharynx that is located in continuation with the nasal cavity on the posterior part. On a panoramic radiograph, it appears as a diagonal radiolucency noted above the shadow of the soft palate. So, here we have the soft palate and the uvula shadow. Nasopharyngeal air space is noted above and diagonal to it. Glossopharyngeal air space is a portion of pharynx that is located posterior to the tongue. On a panoramic radiograph, it is seen as a vertical band of radiolucency which is superimposing over the ramus of the mandible, and it is continuous with the nasopharyngeal air space, below which we have the oropharyngeal air space. Now we have completed the landmarks of maxilla, mandible, supporting structures and the various air spaces and soft tissue shadows which are seen superimposing the panoramic radiograph. Now we will look at few anatomical landmarks and try identifying them on the skull and on a panoramic radiograph. 9 represents the external auditory meatus here. 17 corresponds to nasal septum, 18 anterior nasal spine, 19 represents the inferior concha, 7 here is the zygomatico-temporal suture. You can see here this is the zygomatico-temporal suture, and 22 representing the maxillary tuberosity distal to the maxillary third molar. Eight is the zygoma. Here it appears as a J-shaped radio-opacity. 16 is the nasal cavity represented by the radiolucency at the central portion. Then here we have the mental ridge represented by 36, and the genial tubercle, a small radio opacity noted at the central portion represented by 38. 34, here this radiolucency below the roots of mandibular molars represent submandibular fossa. And 44, this radiopacity onto the posterior border of the ramus of the mandible represents the ear pinna, and here the small radiolucency, small opening which is noted just posterior to the condyle and the ramus is the external auditory meatus. Here we can even locate the mandibular foramen as represented by 31, the canal 30, it is a radiolucent band traversing downwards into the body of the mandible, and this radiolucency is representing the mental foramen. As you can see, it is opening below the roots of mandibular premolar. In this we will note few of the air spaces. So, before that 21, which is a horizontal band of radiopacity representing the heart palate, after which we have 46, which represents the nasopharyngeal air space, and below which we have the soft palate and the uvula, 42 representing the uvula, 40 representing the tongue shadow, So, in conclusion, it is very essential to know the normal anatomy to identify the presence and the integrity of all the anatomic structures, which will help in a proper diagnosis and treatment planning. Panoramic image is a complex projection of the jaw with multiple superimpositions and distortions. It could be because of the structures present and also the technical errors during image acquisition. And also what complicates is panoramic image has a lot of superimpositions from the additional adjacent anatomic structures outside the jaw, again causing a challenge in interpretation. So, some of these anatomical landmarks may mimic a pathology, like for example, we have zygomatico-temporal suture which can mimic a zygomatic fracture, and the presence of mental foramen and its location in the periapical region of mandibular premolars can also mimic a periapical pathology. So, it is very important to have a keen observation and a thorough knowledge about the anatomical landmarks to rule out any abnormality. Thank you.